be speaking majorly about the Sickling screening test. So this is George's Solution, a channel that majorly speaks about medical issues affecting our day-to-day life, and it helps you maintain a healthier lifestyle and be informed medically. The Sickling screening test is a test that is performed to screen for the sickle cell disease. So the sickle cell disease is a disease that is inherited from your parents, and it is characterized by the presence of Hemoglobin S, which is an abnormal hemoglobin. In a situation whereby it is homozygous, it leads to sickle cell anemia. But in a situation whereby it is heterozygous, it leads to a sickle cell. The pathophysiology involves a mutation in the B globulin by a single substitution of an amino acid chain. Hemoglobin S, characterized by low oxygen carrying capacity. So the low oxygen carrying capacity leads to a change in the normal shape of the RBC from a round shape to a sickle shape or a crescent shape. Crescent-shaped RBC has very many disadvantages since it cannot freely move throughout the body. It also has a reduced oxygen carrying capacity. It also decreases the lifespan of the RBC from 120 days to 10 to 20 days. The Sickling screening test is performed to detect the presence of Hemoglobin S in red blood cells, and if Hemoglobin S is present in red blood cells, when it is allowed to stand for very long periods of time, it uses up all the oxygen in it and it forms a crescent shape or a sickle shape. For more rapid results, blood is mixed with 2% sodium metabisulphite solution, which is a reducing agent and removes oxygen from the cells. Right away, I'll take you through how the test is done in the laboratory. So we will require a microscope, weighing scale, glass beaker, pasture pipette, test tube, cover slip, applicator sticks, clean glass slides, Bunsen burner, sodium metabisulphite, distilled water, wax, and a pencil. So first of all, I'll take us through the procedure of preparation of 2% sodium metabisulphite solution. So here is a sodium metabisulphite that is 96.5%. So I'll need to prepare 2% of this. So how to prepare 2% of this? I will dissolve 0.1 gram of sodium metabisulphite in 5 ml of distilled water in a test tube. I will stopper the test tube firmly to prevent oxidation because oxygen reduces the activity of sodium metabisulphite. So I'll just take you through the procedure of how to prepare it. So I'll take distilled water that I had priorly prepared, and I'll add 5 of this to make it 5 ml. So that's 1, 2, 3, 4, and finally 5. So this is 5 ml. So I'll just gently mix it. I'll rock it to make it mix efficiently and sufficiently. So after that, I will stopper it. Remember we said that sodium metabisulphite must be stopped firmly to prevent oxidation because oxygen reduces the activity of sodium metabisulphite. So you can see I've finally stopped it. I'll just shake it more for it to mix very well. So that is my reagent. That is my 2% sodium metabisulphite that we'll use to speed up the rate at which the hemoglobin S reduces oxygen in the surface. Required sample for sickling test is actually freshly collected capillary or venous blood that is anticoagulated with EDTA. EDTA is ethylene diamine tetraacetic acid. This will be our EDTA collected sample, and we place a drop of 2 to 5 microliters on a clean glass slide. So I'll pick a clean glass slide from here. So this is a clean glass slide. Right away, I will pick 5 microliters of EDTA blood. So let me prepare multiple slides just to increase the quality, so that if one goes south, I can still use the other one that has gone north. To efficiently mix up my EDTA venous blood, just mix it very well. So after mixing, I'll open it. Remember, I've set my my micropipette at 5 microliters. So I'll pick and I place the drop on a clean glass slide of EDTA venous blood. I place it at the center of the slide. Again, I pick another 5. I will recap my EDTA and I discard the pipette tip. So I will take my sodium metabisulphite, again 5 microliters, and I pick. Remember, I had initially prepared this, and I also place it I just mix it to ensure that it has mixed well. Remember to avoid air bubbles. Added equal volumes of 2 to 2% sodium metabisulphite solution, and I've mixed well. So I will label the slide with the patient's number. I will label the slide with the patient's number, and I will gently put a cover slip. So here are my cover slips. You need to cover up the side of the cover slip with wax so that oxygen does not enter the cover slip. That's why I'm doing some wax heating here. But you should always take care of open flames. Remember, this is the laboratory. You should be very careful with open flames. Whenever you are using an open flame, just make sure you are very careful with that. So after I've waxed it away, I will pick and put it on the sides. Fill the edges of the slides with wax, and I will examine each slide microscopically using the power 10 objective to ensure that the red blood cells are not hemolyzed. Then I will incubate the sealed preparation at 37 degrees for 1 hour or at room temperature for at least 6 hours or overnight. Examine the cells in details using the power 40 objective similarly, and examine the negative control slides. The negative slides should show no sickling cell, and then examine the test slides and record the results that you will see on the surface. So the results are interpreted as the presence of sickle cell does not distinguish heterozygous or homozygous forms of the hemoglobin S. Other rare hemoglobin types may also cause sickling. So confirmation of hemoglobin type is made by hemoglobin electrophoresis, that is a more advanced test. So you will report the results of the sickle cell screening as positive or negative. So that was a brief video on sickling screening test. If you like the video, just hit that subscribe button, and also share, comment, tell me what you think about sickling cell, and you can also give me ideas on what video to prepare next time. That was Judge's solution. Thanks for staying with me. Bye.